Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, I'm going to share with you some simple exercises to help alleviate and decrease pain in the back of the knee, especially after knee replacement surgery. Before I jump into that, hit the subscribe button, turn on the notifications to catch all of our latest videos. So I do want to take a quick second. Feel free to skip ahead to the exercises, but I do want to say, why do we get this pain in the back of the knee? Why is that so common after a knee replacement? And I think there's a couple or a combination of circumstances that lead to this being so common. One is, of course, you just went through a major surgery, so there's going to be a lot of inflammation and swelling in and around the knee joint. Two is you're going to have stiffness, especially with the swelling and also as the new tissue starts to lay down, the healing process, scar tissue formation, you're going to have some stiffness. And that stiffness can cause stiffness in any type of soft tissue. So in the back of the knee, you have your hamstring tendons are probably the most prevalent, I would say. You also have a small muscle, the popliteus muscle. You have a bursa there, which can sometimes be a cause of a Baker's cyst, which can cause pain in the back of the knee. But I really think that what happens is there's stiffness, swelling, inflammation, and these tendons, your hamstring tendons in the back of the knee, and just any soft tissue, ligaments around that area, just get very sensitive, very inflamed, and really you're adapting to a new volume, a new size of your knee. An arthritic knee has decreased joint space, decreased cartilage. When you go in and have a knee replacement done, they're going to restore that normal spacing, that normal look of a nice healthy knee. So any soft tissue around the knee joint, your ligaments, the tendons coming down from your hamstring, are going to need some time to adapt to that new positioning. They're going to be stretched out a little bit, they're going to be taut. So all those things, the new positioning the new volume of your knee joint, inflammation, scar tissue formation, I think all together lead to having some pain in the back of your knee after a knee replacement surgery. So let's jump into those exercises real quick. So these exercises, one, are working to build strength in the knee joint. They're trying to desensitize any of that pain, sensitivity of those hamstring tendons. And we're also, of course, continuing with all our other exercises, restoring knee range of motion, bending, straightening, strength as well. So one exercise I really like to do, and it's one you might already be doing, is quad sets. And why do I like quad sets? Is because it's essentially a repeated motion for the knee joint. So we're trying to get that knee into an extended, straight position as we push down toward the surface. And it's probably a little uncomfortable, especially with those first couple of repetitions. But what I like to do is have people do 15, 20 repetitions and hold each one for a couple seconds. And in the majority of cases, what you'll notice is the person will start to have less and less discomfort and less pain in the back of the knee as they progress with this. It's just a real easy, simple way to start to decrease some of that sensitivity in the tendons, in the soft tissue, in the back of your knee joint. So of course, if you're not familiar, quad set, leg out straight, pushing your knee down into the surface, into the mat, feeling your quadricep muscles of your thigh contract and tighten, hold it for a couple seconds, 3 seconds, 5 seconds, and then relax and let it come back up. And do, a good 15, 20 repetitions, and hopefully with time you'll start to feel that sensitivity, that discomfort start to calm down. With all these exercises, use pain and discomfort as a guide, but don't use it as something that's going to keep you from doing the exercises. A little bit of discomfort is actually good to work through, I believe, because it's going to help kind of retrain your nerves, retrain those tissues to be able to tolerate these movements. But if your pain starts getting 5 out of 10 or worse than that, we definitely don't want to exacerbate anything. So that's a sign to either change what you're doing in some way or not do that exercise. But a little bit of pain, okay to work through. The next exercise I like after quad sets are going to be hamstring sets. So you're actually going to lie down with a little bit of bend in your knee. Your hamstring muscles, the action of your hamstrings are to bend your knee and also to extend your hip joint. So we're going to use that motion to activate your hamstring muscles, and in turn the tendons of your hamstring are going to contract as well. They're not contractile tissue, but they will tense up. So a little bit of bend, and basically all you're going to do is try to drive your heel into the mat, hold for 5 seconds or 10 seconds, and then relax. Bend the foot up a little bit further, push down into that mat, feel the back of your leg, your hamstrings contract, and relax. And what you want to do is just try all these different levels or amounts of knee flexion. So contracting those hamstrings in different positions. Again, this is going to help with pain management, kind of have a little bit of a pain relieving effect as you do a couple of them. You can hold them for 5 seconds, you can hold them 30 seconds, a minute if you want to. You want to do it at about a moderate intensity, about 50% of your maximum effort. Enough to get that good contraction, but not doing your absolute maximum potential pushing down into the mat. Usually I'll do maybe 10, 15 repetitions of those as well, depending on how long you're holding them. If you're holding them longer, obviously you don't have to do quite as many repetitions. So that's quadricep sets, straightening the knee out, and then hamstring sets, contracting the hamstring tension, tendons and muscles, and giving that pain relieving effect, building up tolerance, decreasing sensitivity of those tissues. Another exercise that's not an isometric one, but one where we're actually moving our body now, is bridges. So lying flat on your back, feet and legs bent up, lifting your pelvis up toward the ceiling, and then back down. So bridges are a good exercise because you will have your hamstrings active throughout the movement, both concentrically with the upward portion, and as you control it back down, some eccentric activation of those muscles as well. So doing 10 repetitions, 2 or 3 sets, another good exercise to start to strengthen and also decrease some of that sensitivity and pain and discomfort in the back of the knee. And then one other one I really like is kind of a stretch, kind of a nerve movement, nerve flossing type movement. So you're going to lie down on your back, and you're actually going to bend your leg up and hold underneath your leg around the hamstrings, around the back of your thigh. And you're going to alternate between extending your knee and bringing your foot toward the ceiling as much as you can, and then control it and let the knee bend all the way down. And you're just going to go up and down with that. You can flex your ankle, so bend your toes toward your head a little bit. That will give you a little extra stretch. So this is multiple purposes. So one, you're just working on your knee range of motion, bending and straightening. You're getting a stretch through your hamstrings. And also you're getting some nerve mobility, some neural dynamics of that sciatic nerve that travels down your leg. Usually I'll do about 10 or 15 repetitions at a time and then relax. So those are the couple of exercises to really start out to help manage pain in the back of the knee. So again, we said quad sets, hamstring sets, bending the knee and pushing into the mat, sciatic nerve glides, and then the bridging.